Welcome to the introduction module for the Clinical Exercise Specialist certification. This introductory video is going to discuss what clinical exercise is and why is it needed. To start that, we need to look at where we are today. So today in the United States, adults have decreased their number of steps per day by an estimated 70% since the Industrial Revolution. Time in front of the television has increased by 1% per year for the past 50 years to a current median screen time of 4.3 hours per day. It's probably even more than that now. More screen time is associated with lower psychological well-being, less curiosity, lower self-control, more distractibility, more difficulty making friends, less emotional stability, being more difficult to care for, and the inability to finish tasks. In fact, the average adult spend only 1 to 5% today engaged in moderate to vigorous activity, and less than 23% of U.S. adults meet the recommendations for aerobic and muscle strengthening exercise. So let's take a look at chronic disease. What is a chronic disease? Chronic disease is a disease slow in its progress and long in its continuance, as opposed to acute disease, which is characterized by a swift onset and short course. And this table lists a number of the diseases you might come across in your business, or you might already be dealing with a client that has one or more of these. So let's start putting some stuff together here, and we're going to do that with Sir Isaac Newton and Newton's third law, which states, for every action, there is an opposite and equal reaction. The reaction to the sedentary lifestyle adopted by a majority of U.S. adults is an overweight and obesity rate of greater than 70%. More than 63 million U.S. adults complain of joint pain, and by conservative estimates, close to 60% of individuals over the age of 60 have some form of arthritis, as do 1/3 of individuals between the ages of 18 and 64. In fact, even by some estimates, everyone over the age of 60 is thought to have one joint with some form of arthritis in it. Close to 50% of U.S. adults have one chronic disease. 25% of adults under the age of 65 have 2 or more chronic diseases. And by 2030, there will be 70 million people aged 65 years and older who have, and 75% of them will have multiple chronic conditions. So, interestingly, at the same time, our lifespans are increasing from about 70 years of age in 1970 to almost 79 now. However, due to lifestyle shifts, poor nutrition, increased inactivity, chronic disease is now starting at a younger age, meaning we will have to live with chronic disease longer, for a longer period of time. So the sedentary lifestyle, less activity, has led to a higher incidence of chronic disease, and the combined result is an unhealthy and aging population placing undue financial burdens on society and taxing an already strained healthcare system. So at this point you might be asking yourself, so what? Well, let's talk about that for a second. So almost 70% of the deaths in the United States can be attributed to chronic disease, which has an associated annual cost of almost $3.7 trillion in medical expenses and lost productivity. Over $1.4 trillion is attributed to cardiovascular disease, and obesity, which is by far considered the greatest burden, costs $1.72 trillion annually. But what is clinical exercise? Well, physical activity is defined as any bodily movement produced by voluntarily contracting skeletal muscle that results in energy expenditure above a basal level, and it can positively affect over 30 chronic conditions, making it the #1 deterrent of chronic disease in primary and secondary prevention. Therefore, the main goal of clinical exercise in the healthcare continuum is to prevent the onset of chronic disease. So what is clinical exercise? Well, clinical exercise bridges the gap between clinical intervention and conventional fitness programs. A clinical exercise specialist, or a CXS, develops exercise programs for individuals or groups who are at risk for chronic disease or dysfunction, or for those who may need specialized care. A clinical exercise specialist works with clients and groups who are at risk for chronic disease, have healthcare conditions which may be mitigated or managed by exercise and activity, are newly diagnosed with disease and need exercise guidance. Maybe they've completed a medically supervised rehabilitation program, such as a cardiovascular program, an orthopedic program, and need to continue. The Exercise is Medicine Initiative was established in 2007 as a collaboration between the American Medical Association and the American College of Sports Medicine. The main goal of EIM is to advance physical activity as a method of primary prevention in healthcare and to encourage physicians to prescribe evidence-based exercise as an intervention in the management of chronic disease based on the concept of interprofessional collaboration. EIM seeks to establish referral networks and clinical teams that complement and leverage the strengths of each team member to improve population health. So according to the World Health Organization, interprofessional collaboration is when multiple health workers from different professional backgrounds work together with patients, families, and caregivers and communities to deliver the highest quality of care. Based on the growing incidence of chronic disease and comorbidities, it makes sense to manage the associated complex healthcare demands. Providers with varying skill sets need to collaborate to deliver the best care possible. So the role of the fitness professional is to work with the client's healthcare team and other healthcare providers. So building this medical network indicates a fitness professional's main goal is the well-being of the client. And the team of providers can include, in addition to the fitness professional, a registered dietitian, a rehabilitation specialist or a physical therapist, a massage therapist, a chiropractor, a mind and body specialist such as yoga, tai chi, or meditation, and the client's referring physician, who is the center of the client's healthcare team and should be provided regular updates as to the client's progress. So for some discussion and application, here are some questions for you to answer on your own, and then we're going to move right along, and you can come back to this and pause on it, and then we're going to come right along and look at the references for this